Well, I'm Lakin Greenwood. I'm the training coordinator at the Onslow County Partnership for Children. I just wanted to thank you all for being here. This is a really important event to us. Given that we all work in the human services field, I would say that I probably speak for most of us in the room when I say that the ultimate goal of our profession is to become agents of change within our communities. We began working in this field because we want to make a difference. We want to cultivate communities that are vibrant and prosperous. We want to build up our clients, and we want to foster growth and resilience in the face of adversity and strife. And we also want to create inclusive environments where everyone, our clients, our families, our children, and all of our citizens are supported and nurtured in a way that helps them to flourish so that they can be healthy, productive, and involved members of our society. That's kind of our why. Like I said, I think I probably speak for most of us when I say that. And it's also the reason that the Onslow County Partnership for Children thinks that Family Services Day is such an important event, and why we hope that you guys do too. So typically, Family Services Day is offered twice a year. We usually do it around the October timeframe, and then also usually around now, so like May or April. And the goal of the event is to bring stakeholders, leaders, and then staff members from various agencies, businesses, and organizations all together in one room so that we can collaborate and increase our knowledge about the services and resources that we have available in our community. And that's why we're so glad that you're here and that you guys are all willing to share your information with everybody. So in putting on this event, our hope is that through networking and the exchange of information, that we can all be more informed, connected, and knowledgeable, and overall just be better able to serve our clients. We want to also be able to work with one another to identify the various issues and concerns that sometimes can burden our public. So a little bit about how today is going to go. It's broken down into two sessions. We're going to have presentation portions and then also networking sessions. This time we are going to have, as you can see in your program, in your folders, you guys have a program, you guys also have a resource guide, and you have evaluations, and then you also have some various flyers from the Onslow County Partnership for Children, and you feel free to collect other things in that. That's what we want you guys to have something to take away with. The presentation portions will encompass about 30 5-minute presentations from various people who are signed up as presenters. We also have a waiting list. If you were not asked about it at the door when you checked in as a participant, you are welcome to go back at one of the networking breaks and let them know our back row is reserved for the waiting list. If people don't take their full time or we have a little bit of extra time in the schedule, I will be pulling from that waiting list and just go tap people on the shoulder and say you're welcome to go up if you would like to. For the networking breaks, we have 2 half-hour breaks. They're built into the schedule. During that time, we hope that you guys will go around to the information tables that people have set up. If you have not already set up a table, you are more than welcome to. Please just wait until the break so that we don't disturb the event. And we hope that you guys can get some resources from each other and be able to network and, like we said, collaborate. The presentations, again, are going to be 5 minutes. Please note that during this time, it's not a time to ask questions because we hope that you guys can do that during the networking portion. That way you can ask more specific questions about your clients and stuff, and you can actually interact one-on-one with each other. If you do have any questions that you have from the presentation portion, please just jot it down on your notepad or something like that and save it for that time. For presenters specifically, whenever it is about 15 to 20 minutes before your presentation time, we do have the back row right back there reserved for you guys. So if you just want to head back there, you can just have a seat and wait until it's your time to present. I also will be giving warnings for you guys. Last year they jokingly said I gave you the finger, so if you get the finger, you know that it's about your time. I'll give a 2-minute warning, then a 1-minute warning, just so that we can stay on track for the day. Again, information tables are set up. They are first come, first serve, but if you would like to do that, please do that. For our resource guide that we have provided for you, to make the most of the day and also to further the goals that we have for this event, we like to gather all this information for you guys so that you can actually have a takeaway that you can go back to your office and look at. I also will be sending out an electronic copy of this version. If you did not If your name was not on the sign-in sheet and you would like that emailed to you, we did have you sign your emails, but if it's not legible, it probably won't go out. So if you wanted to check on that to just make sure if it's something that you really would like an emailed version, I might suggest you do that. And we just hope that you can reference it to take it back to your clients, because those are really the people that are going to need these resources the most. And it's just a comprehensive guide. We take that information from all of the presenters who have presented today, as well as presenters who have presented in the past. And it goes over the businesses and agencies that are available within our community. It goes over the contact information for those businesses, the eligibility requirements for the programs that those businesses and agencies house within them, a summary of the programs, as well as any intake or application processes that these programs have. Also, just some last housekeeping things. If you did not notice before, we did have food and drinks available for you. Please just make sure that you are aware of your trash and we don't leave anything messy or anything like that. There are multiple trash cans out in the back. As well as there's bathrooms and water fountains. If you walk out this door, they're right here. This is a smoke-free campus, so if you do feel the need to smoke, there is a pavilion at the back. You just need to walk out. Usually they leave these back doors unlocked for you, so you can just walk out and then go back there to smoke. If you do have a cell phone, we ask that you silence or put it on vibrate so it doesn't disturb the event. And other than that, we are ready to go. Thank you so much for being here, and I'm going to call up our first presenter, which is Lisa Davis with the Dolly Parton Imagination Library.
Good morning, everyone. I'd like to thank Lakin for squeezing me in and making sure that I could speak with you guys today. I work at the Onslow County Partnership for Children. I'm the Early Literacy and Learning Coordinator there, and probably my greatest pleasure in that job is working on Dolly Parton's Imagination Library. So I don't know how many of you are familiar. I'm hoping word is starting to spread, and most of you would definitely pop your hands up and you're out recruiting, you're stopping people at McDonald's like I am, you're parents with strollers see you coming and they start trying to run, but you chase them down. I do have some flyers that I'll put over here on the table along with some business cards, so if you'd like more information, I can share it with you. But the gist of the program is this. About 20 years ago, Dolly Parton decided to start a book gifting program for the children in her home county of Sevier County, Tennessee. And the goal she had was to make sure that those children entered kindergarten ready to learn. And we know the single biggest predictor of children's success in school is the time that they spend reading aloud with their parents. So she set up a program through Penguin Books, Penguin Publishing, where children got a brand new age-appropriate book mailed directly to their home every month. So it didn't matter how many children were in that family that served children birth to 5. So they graduate at 5. And then we're constantly looking for new members to add to our Imagination Library. Right now in Onslow County, we have had the great fortune of having the General Assembly fund us for this first year for 10,000 slots. That ends June 30th. Then our next fiscal year, we'll be able to keep that 10,000 and add 5,000 more. So in our county, where we usually average 24,000 to 25,000 children ages birth to 5, we have the opportunity to really serve a large portion of those children. Right now, we are hovering around 8,200. And so that's why I'm here today, to make sure you know about this resource for the families that you serve and to ask you to help me get these registrations done. We want to make sure that at the end of this 2-year pilot program that the General Assembly is funding, that they see that the children in North Carolina, particularly Onslow County, where we are, have been participating in the program and are going to be able to enjoy those benefits of having that home library before they ever enter kindergarten. So some important facts about Imagination Library would be that it is not income-based. Dolly Parton's idea was that all children would receive these books, that it wouldn't be a book program for children of poor families, or it wouldn't be a book program for children with families who could afford to buy them, but that ideally on the first day of kindergarten, the teacher would be able to hold up a book and say, "Who here has this book at home?" And every child would raise their hand, so that it would create that sense of commonality and community within the children themselves. So there is no income basis. We've had some families say that they would rather turn the book down, the membership down, because they don't want to take the spot away from a child that might be in a more needy family. But for us, the numbers are very important. For us, it's making sure that those 10,000 children this year have them, and the total of 15 by the end of next year do as well. So, and again, it doesn't matter how many children are in the family. We'll have them say, "Oh, well, I'll just sign up one." If you have 4, if you have 5, I had one lady who has 3 of her own and just took in 4 of a friend whose family was about to be dually, what's the word when they send them out? Deployed, that was it. So she took on those 4, and she called and she said, "I don't want you to think that I'm trying to scam you when you see all these children." I said, "Honey, if I had the money, I'd send you like a maid, a nanny, a something. You know, I would definitely help you." So my ask today is, take these forms with you. Give me a call. Ask me about that. We can help you set up something that would be meaningful for the organization you work in. But remember, enroll your own children. Help the staff that you have enroll those children. A lot of times we're so service-driven, we automatically go to our clients and forget our own staff. So enroll them, enroll your clients. Think about where you get your hair done, where you eat dinner, post it on Facebook. All of those things help us reach those children that are just beyond our grasp, and then it helps them to spread it to more people that they know as well. So with our goal of 10,000, I'm asking if you'll be a partner with us to make sure that the children in our county receive this service. I'm watching Lake, and I already got that finger. I got that finger. I know what the next one might be. So I am done. Okay, but I'll be around till after if you'd like to ask any questions. Thank you.
Good morning. I'm Heather. I'm one of the nurses with Navy Relief. This is Natasha. She's also one of the nurses. And what we do, Navy Relief is actually known for financial aid. It is a military-based program, so you have to have an ID card to use our program. It is mostly to help with financial assistance. But then we also have the nurses that do several different things. We have wounded warrior or combat casualty nurses. And there's 4 of them now. The program actually says 3 in the brochure, but we now have 4 nurses that do that. And what they do is they can help anybody who's been wounded or injured in a war zone or their families. A lot of people actually get us confused with case managers or caseworkers. We are not. Caseworkers and case managers normally just see the actual service member. We can see their family as well. So anybody that's gotten out of the military because they were injured or wounded, we can help them. We can make sure they make it to their appointments, make sure they have all their paperwork filled out appropriately. So anything really that they're just kind of lacking or not sure of, we can help with. Again, you just have to have an ID card. You can be a family member. You can be a mother, a father, a sister. It doesn't matter. And then the way we can get referrals is you can self-refer, or anybody can call our program and actually do a referral. If you're not sure if we can accept it or not, please just call us, and we can actually just let you know whether we can or cannot accept it. Every case is base by base. So again, please don't think, oh, I don't know about this one. Call us and we'll let you know, okay? And then the other thing that we do is mother-baby nurses, and that's what Natasha's going to talk on.
Okay, I'm not a good public speaker, so I apologize if I fumble over my words. But so the mother-baby nurses, we're also called traditional nurses, and there's 3 of us on Camp Lejeune. And what we do is we go out and see new mothers. Well, it could be more, they're not their first child. It could be multiple children, but they've just had a baby, and we go out to their homes, and it's not mandatory, it's completely voluntary, and we can weigh and measure the baby, do an assessment, answer any questions or concerns they may have. We make sure the mom's doing okay. We bring local resources out with us. We share a lot of the stuff that we get here with them if it's appropriate. And we're also lactation counselors, so we help them with breastfeeding as well. And then another thing we offer is the Well Baby Clinic, and it's offered twice a month at TT Community Center. And one of us nurses are there available to weigh and measure the baby and answer questions, and we also have used clothing that they can take with them, and we accept donations as well. And we also have a Budget for Baby class that we offer twice a month, and that's just exactly what it stands for. We teach them how to budget for having a new member in their household. And when they come, they get a free blanket that our volunteers make, and then we also now are giving $25 gift cards. I think it's a Visa gift card, right? Mm-hmm. Yeah, to go towards the baby. That's it.
Good morning. I tried to get up here fast before y'all stop clapping because it's awkward to walk up with no noise. My name is Stephanie Learn. I am from the College and Career Readiness, formerly Basic Skills program at Coastal Carolina Community College. So we serve people who are working towards their high school equivalency or adult high school diploma. We currently have 3 programs at the college. We offer 6 sessions, 2 in the summer, 2 in the spring, and 2 in the fall. We have an ABE, and which is an adult basic education and adult secondary education program for those seeking their high school equivalency. We also give classes for the adult high school students who are receiving a North Carolina diploma. So we offer those students who need a credit or 2 to finish and get a diploma. We also have an ESL program where we offer language acquisition classes for students whose language is not English or are seeking citizenship here in the United States. Our program is free completely. We do have some requirements that aren't always popular with the students testing, but they do it, and we are able to offer it free that way to them. Other than that, that's what we do. We're at Coastal. We're in the 2nd story building across from the Smoothie King. I think we offer something that is probably more important. While we don't necessarily offer financial support, we offer something even more important, which is an education. And for a lot of our clients, that is the first stepping stone to getting a better life. And so we encourage you, if you have people who have not gotten their diploma or who have not graduated high school, please send them to us. Again, 2nd story building above, directly across from the Smoothie King. That's it. I didn't even get a finger.
Good morning. I was surely hoping that our director would walk in so I didn't have to come up here. I'm Tamika, and I'm from the Onslow Women's Center, which is the domestic violence center here in Jacksonville. We also see men. Our name is kind of misleading, but we also see men there. Excuse me. So we are there just to support the individuals, the victims of domestic violence. We offer case management. I'm the caseworker there. And we also have Hispanic outreach. We have sexual assault agency that they go out to the hospitals. They can see the victims there. We also have a thrift store called Finders Keepers. It just moved to the new location next to Peebles. So if you know where that is, it's directly next door to there. Excuse me. And we offer everything that comes into there, the donations go right back into our agency. So anything that's sold, anything that's brought in, if it's not sold on the floor, it can be used for our safe house victims and also our community clients, which are the clients who I see that are not in the safe house. Let's see. So I have some pamphlets and some things over there for any additional information. We have a crisis line that is 24 hours a day that's manned. And we also receive donations of food and diapers and any kind of personal hygiene things in our office, but all the other things, clothing and furniture and things, we ask that are sent over to our thrift store. Okay? All right.
Good morning. My name is Simeon West. I'm with the Onslow County Community Liaison. We help with child support. One of the things that we do that I can describe our business is we go and do clear values. We go and make sure that we're loyal, we're ethical, and we're accountable. We try to make sure we bring a value to Onslow County because one of the main things we want to do is make sure that every child is taken care of. Now, child support services are a federally mandated program, and it's a component of the federal act. It's a Title 4D. So one of the things is that whenever people come into our office, it's broke down, and if you're receiving Medicaid, you can come into our office. If you're receiving any type of Work First or TANF, you can come into our office, apply for the services. We'll do a referral for you, and you don't have to pay for the services. However, if you want to come into our office and just open up a case yourself, you can do that. It's a $25 application fee, and we go and make sure that we go and help our community. One of the things that's mostly important is that if people go and need help with establishing paternity, we can do that. We have our teams broken down from an establishment team. We have a team that's a judicial team that will go and take the cases and go and talk with people in the court system. And we also have an enforcement team that will go and make sure that they go and help these children in our county. One of the things that I look at the values that we bring to Onslow County is that we go and get into the community. If there is a non-custodial parent that actually needs any assistance with paying any child support, we go and provide that assistance. We go and make sure that we go and help them by partnering with each and every person in the community. Whenever we go and try to go and get these orders taken care of and we put them in the system, we make sure we work with both parties. We talk with the children, parents, and we try to go and get a mediation. Because what's important is that we want to make sure both parents come together and go and decide on what they can do to go and help the child. Also, I want to go and say that we are very reliable with our services by any type of application fee by saying if you need a little bit extra time of paying those fees, we'll give you extra time. You just got to make sure you communicate with us. That's the biggest thing, communication with our services. We want to make sure that we provide any and everything for everybody in our community because, again, the children are what's most important. People can come to our office and they can go and apply for services by filling out an application, or they can go to a website. They can go to www.onslowcountycss.com and they can pull the application up, they can fill it out. If they want to, they can email it to a caseworker. A caseworker will go and print it for them, and they'll go and make sure that when they come into the office for services, they have everything ready for them. Also, our main office is at 201 Parkwood Drive in Jacksonville, North Carolina. And furthermore, we have another office that's on TT, that's in the WIC building. If you want to, you can always go and call the number 910-938-3563. We're here to help our community any way we can. We're here to help the military community in any way we can. And that's what we do. Thank you very much.
Good morning. My name is Shelley Kewig. I am the Community Impact Director for United Way of Onslow County, and today I'm going to talk to you about Volunteer Onslow. Last time I didn't have a script, and I seemed like I was all over the place, so don't mind me reading a little bit. Volunteer Onslow is a clearinghouse. I call it your one-stop shop for all your volunteer needs. It's an opportunity for local nonprofits to post needs and connect with those wanting to fill those needs. The local program helping to build capacity for local nonprofits and a resource center for nonprofits and individuals looking for volunteer opportunities. It helps the community with countywide service projects, service fairs, individual projects that help make Onslow County a better community. Volunteer Onslow has a large online database of both volunteers and volunteer opportunities that can help find you the best volunteer for your particular need. As a service partner with Volunteer Onslow, you'll be able to post all of your volunteer opportunities into the online database, which is going to be viewed by more than 4,300 volunteers that we have in the system right now. You'll receive an email confirmation whenever a volunteer registers for your event or takes themselves out because they're not able to do it. When volunteers assign themselves to your organization or select you as a preferred organization, you as a service partner can then view the volunteer's name, the assignment they selected, and what role they're wanting to perform. You'll be able to view your organization's schedule of opportunities in calendar view, showing how many slots are available, how many still need to be filled, what you're needing to still complete in order to get that event, make it successful. If a volunteer has either been assigned or indicated your organization as a preference, you have the ability to schedule them for a specific slot that you need them for. Another awesome feature with Volunteer Onslow is if a volunteer fans your organization, anytime you post a need, they're automatically going to get an email saying that you need a volunteer, and those are going to be the first ones that will come and say, I want to volunteer for your organization, and you're going to get those same volunteers over and over again, which you become familiar with, and those are the best volunteers to have. So what are the requirements? Be a nonprofit agency or public entity serving valid community needs broader than the interests of the membership. Have non-discrimination policies in place that reflect state and federal law in regards to clients served and volunteers accepted. Provide services and volunteer opportunities in Onslow County. Organizations do not need to receive funding from United Way in order to be a part of our Volunteer Onslow website. If you're interested, you can go to volunteeronslow.org. You can create an agency account. Once your account's created, it'll inform me, and I will get an email, and I will contact you so that we can set up a time and place to get together so we can go over the paperwork and the training involved in using our website. Another great thing that we do for our volunteers is every year we have a volunteer recognition called Golden Rule. Your job as the agencies is to nominate these volunteers who are exceptional to become a part of this amazing event where they can, they're put into the newspaper, they are recognized, thank you, sorry, I can talk forever. They get an award. I mean, it's a huge event, and the biggest thing is to make sure that you nominate. We didn't have a whole lot of nominations last year, and this is a great recognition for our volunteers. I just want to end with a quote. Remember, volunteers are not paid, not because they're worthless, but because they're priceless.
Good morning. How can you top the priceless comment, Shelley? So I am Pamela Trafton. I'm the Community Engagement Coordinator with the City of Jacksonville, and I am here not to introduce to you our Community Engagement Department. It is a true play on words when I tell people what we're doing, because we literally are here to engage with our community, so hence community engagement. One of the things that we do is we have residential rehabilitation. A lot of it is focused towards low-income or moderate-income families within the cities. So if you know of any residents that have a need to have some minor work done on their house and they can't afford it, then the city has grants that are available that if they qualify, they can actually get some of those rehabs done without a charge to them. If they are not within a certain income, then it becomes a loan, and then they have to turn around and pay it off over time. Another process that we have is our home buyers education program. That is held every other month, and you do not have to be a city resident to actually attend the home buyers education course. And it's a full 8-hour day. They get an opportunity to hear from realtors, mortgage lenders, foreclosure prevention specialists, someone that's going to take them through the process of A through Z. It's a snapshot of 8 hours, but it still gives them that opportunity. Our next class, because our May class is full, is July 21st. And it's $10. They can call City Hall to sign up for it, and it is a full day of Saturday. Lunch is provided, so no worries, you'll get to eat. I am also over our youth council. So if you have any high school students, please send them to me. If they are in the outlying schools of Richland, Southwest, Dixon, Swansboro, I need them, I need them, I need them. If you are in the school system and you are at any of those schools, I need them, I need them, I need them, okay? So please stop by, see us. My number, if you have any additional questions, is 938-6551. Thank you.
Good morning. How are y'all doing? We're going to talk about some free services. Go Pierce. I just needed to wake y'all up a little bit. Okay. My name is Tondria Leach. I'm the director for Pierce Family Development Center, and I'm here to talk about the free services that we offer in our community. So how many of you have ever heard of Pierce Family Development Center? Oh, we're going to have to get everybody's hands raised by the end of this. Okay, so we have been in our community for 42 years, believe it or not, and we've been offering free services. So one of the first valuable services that we offer is free parenting classes. And with our parenting classes, we offer free childcare and a free meal, regardless if the class is during the daytime or if it's at nighttime. And we offer a variety of wonderfully evidence-based curriculums. So we teach anything from IY to group triple P to making children mind without losing yours. How many of your parents, you feel like you're losing your mind sometimes? It's a wonderful class. Come on. Anybody can sign up for these classes, and anybody can refer another person. We've even had grandparents call and sign up their own kids and say, my son needs their parenting class. Get them in there. So anyone can sign up for any of our parenting classes. And I'm leaving some brochures at the desk right beside United Way, so feel free to pick some up. We also offer adolescent parenting program. We are number 2 in the state of North Carolina for teen pregnancies. We've got to get it under control. However, we're here to help the girls and the boys who have children or expecting children in their teen years, helping them to become the best parents they possibly can be so that we can help prevent some CPS down the line, some bad feelings between parents and children. We're offering them different types of parenting skills, life skills, different types of supportive services. We make sure our teens get to the doctors, the dentists, make sure their kids are getting to these things. And there's an incentive. They get incentive points all around. They love their diapers and wipes with their incentive points. And it really does help them stretch the money that they have as teen parents. So again, anybody, please feel free to make a referral anytime you have a mom or a dad expecting or already having a child. They can be served all the way until the day before they turn 20 years old. And this is so vital because DHHS has just let us extend it all the way up until the day before their 20th birthday. So even once they graduate, we can still provide services to them. So call us. We also offer free childcare. So free childcare, what we do there, we have 2 providers, an infant room and a toddler room. And we have children from birth to 5 years old, Monday, Wednesday, Friday from 9 to 1. It's a free service. It's respite care for parents. Sometimes you just need a nap. Sometimes you want to shower without your kids knocking on the door. Sometimes you just want to go to the commissary without kids telling you what to buy. And it's okay. We don't judge you. Come on. You can bring your kids here. You call us. We're going to get you registered, get your kids registered, and then you can call and get your appointment anytime you wish, Monday, Wednesdays, and Fridays. Any questions? Can y'all tell I've done this before? I hope you all have a wonderful day. And call Pierce.
That's a really tough act to follow. I'll have to remember that next time. My name is Jenny Ormsby, and I work with the Family Member Employment Assistance Program on base at Camp Lejeune. And we are located on the Taro Terrace location across from the community center right next to Spectrum in the Taro Plaza. What we do is we provide employment services to military spouses, family members, retirees, or basically anyone who has base access. And what those employability services look like are creating a resume from scratch, targeting a resume to a specific job, finding a job, application assistance, especially with regard to applying on USA Jobs or applying with MCCS, because we all know that those are a little bit more complicated than the normal application. In addition to the employability services, we have a number of different classes that focus on some of those topics. So we have classes for interviewing skills and navigating USA Jobs and MCCS. We have classes on resume writing and job searching. And so we have a list of those classes over there. So in the networking time, you can come over and get that list and when those classes will be held. In addition, we partner with Coastal Carolina Community College and the Human Resource Development Department in order to host week-long classes that focus specifically on some of those skills and that allow people to have specific hands-on experience in interviewing techniques and writing their resume. All of these classes are free classes. In addition, we can offer free childcare on base at the CDCs as long as their children are registered within the CDCs. We have a computer lab at our location, so we have 6 open computers where people can just drop in and do a job search if they just need to get away from their kids or if they need to have access to a printer or a scanner so that they can upload any of their documents for their application process. So they don't need appointments in order to utilize the computer, but we do ask if they want to access our services and resume writing skills and that type of thing, that they schedule an appointment with us. Lastly, we host job fairs, and this year we recently partnered with the Jacksonville Youth Council to host a teen job fair. So that's something where we hosted 23 volunteer organizations or employers and over 120 teens in order to connect them with the different opportunities to help them develop their resume or applications for school in the future. So thank you very much.
Good morning. My name is Lindsay Gress. I am with the NC Works Career Center here in Jacksonville, and we are your state workforce agency located in Onslow County. So there are 81 of us located across the entire state of North Carolina, and we're here to help you in any of your employment needs. So whether you are a job seeker who is unemployed, underemployed, or possibly looking for a change in your career field, come see us. We have career advisors that can help you. In your job search, you don't have to go through this alone. Oftentimes, it can be very overwhelming to search for jobs, and we don't want you to be overwhelmed. We don't want you to be frustrated with the online applications, with the resume process. We want you to come and see us. Our career advisors are available. You don't have to have an appointment. You can come in, sit down with them one-on-one, and just talk about your job search and talk about what questions and concerns and challenges you have to your job search. We do, if you want to make an appointment, you can. Again, you don't have to. We're open Monday through Friday, 8:30 to 5. We are located at 461 Western Boulevard. For those of you that may be familiar with our former name, we were the Employment Security Commission. We were the Unemployment Office, informally. But we've rebranded because I had a wise staff member tell me one time, we are not in the business of unemploying people, we are very much in the business of employing people. So we want to make those connections. We want to connect talent to the jobs that are available. So not only do we meet with job seekers, either one-on-one or in our Career Resource Center, we do have 7 computers available that you can come in and use at no cost. They have internet access. You can complete your resume there. You can fill out online applications. You can print off your resume. You can print applications. You can, those resources are far and wide. We want you to be successful in your job search. In that Career Resource Lab on Mondays through Wednesdays from 9 to 1, we partner with Coastal Carolina Community College, and we have an instructor that comes in, and she is there to, again, assist you in your job search. So if you get stuck in that online application, you're not sure what the employer is looking for, the website is not cooperating, you can't figure out how to upload your resume, get your cover letter in there as well, we have somebody that can help. Again, we don't want you to be frustrated in this process. We want you to be successful. So again, she's available Monday through Wednesday from 9 to 1. Again, as a job seeker, please come and see us. Now, on the employer side of it, we do have employers that can that post their jobs with us. So we have the State Labor Exchange, which is www.ncworks.gov, and that is a website that employers post their jobs to at no cost, and job seekers can search for jobs, again, at no cost. So this is your state taxes at work. I encourage you to use it. Employers do post those jobs. We encourage employers to make sure those descriptions are very specific, as we encourage job seekers to make sure your resume is very specific so we can have a good, true match for qualified applicants and to meet the employer's needs, their workforce needs. We do have hiring events in the Career Center, typically on a weekly, if not a few times during the month. And we encourage you to come out, and employers will come in. They will do interviews on the spot, and we have had many people get jobs on the spot. So I encourage you, come in, learn more about those hiring events, and check out what we can do for you. Again, career advisors are available, and there are additional services that we're going to talk about. Nicole's going to be up next talking about education and training, and then our financial coach will be here. Please understand, too, we do have veteran career coaches. So if you are a veteran or an eligible military spouse with a significant barrier to employment, I encourage you to reach out to us. We have veteran career advisors that are able to meet with you, sit down, talk about your challenges, and ensure that you can be successful in your employment by overcoming any barriers to really ensure that any of those barriers don't impact you when you do start working. So again, our goal is to connect talent with jobs and to ensure that you are successful, not frustrated, not overwhelmed. Our phone number is 347-2121. We're open Monday through Friday from 8:30 to 5, and we're at 461 Western Boulevard, NC Works Career Center. Thank you very much.
I think my partner Stephanie had the right idea with trying to get up here before the people stopped clapping so it wasn't awkward to walk up. My name is Nicole Hall, and I am a Workforce Innovation Opportunity Act Career Advisor. I work with Coastal Carolina Community College, partnered with the NC Works Career Center. This is a super underutilized program, and it makes me sad because there's so much to offer. So the first thing that we have is we offer training and education services. So if somebody wants to come in and they want to train for a job, if they want to change careers, but they don't have the financial means to do so, if they are receiving food stamps, if they are low income, if they are underemployed, they have a chance to qualify with us. And if they wanted to come in and, say, get an associate's degree, if they wanted to study continuing education classes, we cover all required costs for those programs. We cover the tuition, we cover the books, we cover the insurance, the uniforms, the state board exams, whatever is required to finish that education and training program. And what do we expect in return? Everybody wants to know, what's the catch? The catch is that we expect them to get a job at the end. The popular question lately has been, do I have to get a job in what you paid for me to go to training for? And my response to them is always, if you were certified and now you are a doctor, why would you want to go work at McDonald's? So yes, we do expect them to try to gain employment in the field in which we train them to do so. Sorry, I made notes because otherwise I will talk forever. Okay, we have three different options. We have three different programs for the WIOA. We have the adult and dislocated worker. The adult program is, like I said, focuses on the low income or if they are receiving SNAP benefits of any kind, because the SNAP benefits can justify them as low income. We have the dislocated worker. Dislocated workers are people that have been long-term unemployed, people who are receiving unemployment. We can also look at the fact of dislocated or displaced homemakers. It's a difficult, we look at spouses who have followed their husbands or wives here, if they have PCS here and had to leave a job and are having more trouble getting a job here. I am the caseworker for the WIOA Out of School Youth Program. The Out of School Youth Program is a little bit easy, very easy to be able to qualify for. If you are under the age of 25 and are pregnant or parenting, if you have ever been in trouble with the justice system, if you are homeless, runaway, or in foster care, or have not graduated high school or an English language learner, you can probably qualify for the Out of School Youth Program for WIOA. So that encompasses about probably 90% of Onslow County. The other problem is the only time we ever look at income with a student who is under the age of 25 is if they have graduated from high school and score more than 9.0 on their TABE score. We do look at income at that point. Okay. So with the WIOA programs, like I said, we can cover the tuition, the books, any required costs associated. The other benefit with the WIOA program is with the Out of School Youth Program is we have a work experience program. So while they are taking classes and while they are doing their studying, they have the option of working on campus, jobs that we place them in to help them to be able to gain references, to gain experience and jobs that they can take to a future employer. Because many of the students that I work with come in and they have no job experience, or they have jumped from job to job to job, and have no referable people to be able to put on a resume once they get that training and are applying for those career positions. There is not a time period that is set for being in the program. I can tell you that we cover not just things at Coastal, but things on a regional basis. So anything from that's offered as a community college, CDL training, medical training, early childhood education are just a couple of the top ones that we cover on a regular basis. This is not a loan program, it is a grant program, so it is not meant to be paid back. This is an option by the federal government to help people to be able to get the training that they need to be able to go back to work. There are brochures in the back that talk a little bit about eligibility, and I can give you my information if needed. Sorry, I could talk forever, but I'm getting fingers, and she's going to cut me off in just a second. But I'll be here all day, and if you guys have any questions, I encourage you to come and talk to me about the options that we have through WIOA. Thank you very much for your time.
Good morning, everyone. I tried to rush up here before you guys were all right about the applause. My name is Nadia Mayora. I am a veteran financial coach partnered with NC Works Career Center. So as you can see, we are a team with the same purpose, and is to help people. My job as a veteran financial coach is I assist individuals who are interested in establishing financial goals. Examples would be creating a spending plan, a budget, cleaning up their credit, looking into buying a home. The only thing that I do not do is deal with investments, just because it's very touchy, and it's just a certification that I do not uphold. I am the only veteran financial coach in the state of North Carolina that offers this service for free. Did I say for free? Everybody loves that word, free, 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 free. I do not, don't work for a bank. I don't sell any products, anything, insurance, any of that sort. I'm actually contracted by the Consumer Financial Protection Bureau, which is our mission is to teach financial literacy to people who want to learn and get out of any financial hardship that they may be having. I sit down with a client either one-on-one, over the phone, or virtually. So wherever the client feels comfortable sitting down with me. Finances is the most difficult thing for somebody that I've learned for individuals to talk about. So I accommodate their needs as much as I can. I am a veteran-based program, but I do have, because the need is so much needed, I am authorized to see non-military. So I kind of, also military actually, I actually forgot that I actually can see military as long as there are 30 days from their EAS date, which is their terminal date. And like I said, the need is there. I am here to assist. I am located, like I said, at NC Works Career Center. I am the only did I say this again? Sorry, I'm repeating myself because I'm a little bit nervous watching all of you. The only coach in the state of North Carolina, there are 60 coaches throughout the United States. So even if I know there's some providers here from active duty services, so if you know of anybody who may be in a transitioning out, I know there's services on base that offer financial counseling, but if there is a need that somebody may need, as they're PCSing somewhere else, there is a financial coach more likely where there would be PCSing. For more information, please come to my table. I'd like to put a face to a name and get to know each other and all of our resources. Thank you so much for having me, and have a good day.
My name is Robin Seitz. I'm with the Onslow County Health Department, or Onslow County Public Health. We are in the process of rebranding. So are you part of the public? Yeah? We have something for you. Do you ever eat out? Do you look for that restaurant grade inspection? You know who does that? Environmental health, part of the health department. So if you live in Onslow County, public health has something for you, okay? Most people have their ideas on what public health has to offer. What does public health do for you? What do you think of when you say public health or the health department? What do you think of? STDs. We always do that. Yeah, we do that. Public health does that. What else? Immunizations. Public health does that. What else? Pregnancy care. We do some of that, actually. We do that. So, as you can see, we do a lot of things. I'm a health educator, so I do education. I'm sorry. I'll stay here. I don't like that microphone thing. I do health education. We have chronic disease education programs, specifically prevention programs for diabetes, treatment programs or management programs for diabetes, blood pressure management, those kind of things. We also do outreach in the community, so we go into the community and do health fairs with employers who have health fairs for their employees, churches who have health fairs for their families that are involved there. I have a lot of brochures over on my table on specific programs that we have. We do birth control. I'm surprised nobody said that. That's usually the second thing we get. We do child care coordination for children. That's a program that works with children who may have some special health needs that we can assist them with getting the care and the services that they need. So it's a good thing for us to be here. We should probably all be here, sitting here listening to what you do, and us as well. If we don't already partner with you, we would love to. I can guarantee you that. We do have an international travel clinic. That's something that we like to make sure that people know, because we haven't always had that. It's been here for about 3-4 years. The International Travel Clinic, if you are traveling internationally, sometimes you have to have an immunization that you maybe wouldn't necessarily get if you're just going to be here in Jacksonville, North Carolina. If you are going to do that, you can call the health department, tell them where you're going. We can get the immunizations that you need. You can come into the health department and get those shots, and you won't have to travel. Previously, you would have had to travel to Wilmington or Greenville to get those shots. So, which, if you're traveling, you may not mind, but you might want to get your shots here. We do nutritional counseling. We have registered dietitians who are available to see you. Just call. You need a doctor's referral for some of those things. So talk to your doctor. Usually they don't have a problem giving you that. We do women's health. We talked about that. We do offer some classes for parents-to-be, as well as some new parent classes. I'm trying to think. Communicable disease. We handle tuberculosis and also as well as the STDs. So we do have confidential teen services. So if you have teen clients, that need our services, women's health services particularly, those services are confidential for teens. And WIC, don't forget about WIC. A lot of people know WIC and don't really associate WIC with the health department, but they are located with us. We are located at 612 College Street in the new Consolidated Human Services Complex, big building. We are co-located now with social services, and we are so excited to be consolidated. We're so excited to all have a nice, clean place to work, because if you've ever been in either of our old agencies, you probably are not jealous of us having a new place. So thank you. Please come over and visit. Like I said, I have a lot of information I would love to share with you.
That's a tough act to follow. First of all, good morning. Thanks for being here, because I think we have a joint mission. That's take care of families and take care of our children, because a lot of times what children see as they're coming up, it means a lot to the parents that they're about to be. Real briefly, because I know we're on a hard break to follow, but we can network. I want to take a few minutes to tell you about your sheriff's office. It is your sheriff's office. It works for the people. We have 5 divisions: personnel, administration, and training. Training is so necessary. Permitting. Second one is investigations. Investigations, since we're on the subject of family services, we have a special victims unit. About 3 years ago, I saw a need to create a special victims unit, and what they do is they investigate crimes against children, crimes against women. You know, it takes a special kind of person to do those kind of investigations. The third one is patrol. That's our bread and butter. When a citizen calls for service, that's what they typically get. They get a uniformed officer that comes out, takes the report, finds out what happened, does a preliminary investigation, and takes good notes to see if it needs to be investigated further, or whether just a report has to be taken for whatever purposes. And there's some subdivisions of patrol as well. The fourth one is our detention center. We've got people in custody that are waiting for court. A lot of them are innocent until proven guilty. They have to be fed, they have to be safeguarded from each other, and sometimes from themselves. And I'm very proud of the way that it's being managed. We got very high marks when the state comes down and inspects our detention center. And the fifth division is civil. Civil is court security, our school resource officers. Those are the officers that are in direct contact with our middle school and our high school students. And there's so many other things that I can talk about, but I'm running out of time. My challenge, our challenges that we see is opioids, the opioid situation. Now, being addicted is a disease. We need to have treatment post, whatever happened, but treatment is necessary for the addicts. But also the criminal part is providing the poison. And we have to get the people that provide the poison to our young people, and sometimes even our elderly people. We've got to do something about that. Also, domestic violence. Coincidentally, on Friday, I'm going to be spending a day up in Raleigh, because I'm part of the statewide Domestic Violence Commission. So if you have any comments or any suggestions about this violence in a family, is a terrible thing. I think we would all agree. But a lot of times our children will see that, and then it becomes their new normal. We don't want that to happen. So maybe for all of us to stand together against domestic violence. Child abuse, child neglect. Officers see that very frequently. Unfortunately, it's another thing that we need to stand together as professionals. All of us stand together against that. And I mentioned opioids already, methamphetamine, the creation of illegal drugs. But also, right now, I'm focused in the next, when school starts again, we need to be out in the schools a lot more, because some of the violence that has occurred in other states, thankfully not in our state, but in other states, in school violence and also church violence. We've been very active connecting with churches, offering our training to look for behavioral clues, things like that. I know I'm running out of time, but I want everybody that's here to know that we work very closely with the base, with the police agencies, with human services, with DSS, with the health department, because what we need is cooperation and collaboration. And Captain Rowe is in charge of the school resource officers. I am envisioning sitting down with the school board and the Board of Commissioners to figure out what the next step is going to be to protect all of our children. We've got to protect our children because they are going to be the leaders of the future. So thank you all for being here. And Captain Rowe, you got anything to say? No?
Just one thing with your agencies or anything, we also have 4 child seat car technicians. We can, if you get some people that don't know how to put their car seats in correctly, send them to us, get up with me or Sergeant Butler, and one of us can, we're not going to put it in for them, we're going to show them how to put it in the correct way where the kids will be safe in there, okay? So thank you.
Thank you all.
All right, guys, it's been a great morning. We had some great presentations. So now we want to just open it up for you guys to go network with each other. So if you would like to go to the tables, again, I do want to let you know, like, as you can see, we're a little bit ahead of schedule, which is great because that gives you a little bit more time to network. But that also lets you know that we have some time that I can squeeze you in to present if you would like to. If you want to, just come on up to me or my ladies in the back, and we will put you on our list, and I will make sure to get you up here so you can talk to everybody. But we will come back together at 9:45. And I'll give you like a 5-minute warning beforehand. Thank you. Oh, no, I want to use this. All right, guys. So we're going to get started again. Just for any new presenters that have come in since I gave my welcome speech, presentations are 5 minutes. They're going to cover your program requirements, any eligibility that you have, and then just like a summary. And then I'm going to turn it over to our next presenter, which is Stephen from Coastal Horizon Center. Oh, also, if you don't want to stand behind the podium, that is totally fine, but we do ask that you use a mic. So if you could just let me know at the back, I'll give you our wireless mic so that you guys can stand out from behind the podium.
I'll let somebody else use the wireless mic. I'm Stephen Riemann. I'm with Coastal Horizon Center. I'm our community-based program director, which essentially means that I direct people that provide mental health and substance abuse services in the home. So truly that's what we have here in Onslow County. It's called Intensive In-Home Services. It is a mental health substance abuse service that works with children under the age of 21. The catch is they have to have Medicaid or health choice insurance, which is unfortunate. It's not a me thing, it's an insurance thing. If anybody can help change that through private insurances, then please help. But the private insurances will not pay for that service. what intensive in-home is, it's a team of 3 people. There's a licensed clinician and 2 other qualified professionals that will go out individually and work in the home with these kids and their families. These are your kids that are significantly at risk of removal from the home because of their own mental health or behavioral health symptoms and behaviors. So these are your kids that are going in and out of the hospital. These are your kids that are in residential treatment facilities. They're in group homes. They are in traditional outpatient and they're being seen weekly or every other week, and it's just not working. They need a little bit more than that. Give me a call. Give Jason, he's my counterpart. We're back at that table. You can get our number and our cards, emails, and we'll do our best to help you out with those kids. If you have, some kids will confuse you, essentially. You know, these aren't necessarily your kids that are just running the streets and getting in fights, or maybe they're cutting themselves or attempting to take a bunch of pills or hang themselves. Sometimes these are the kids that are in your classrooms that just have their head down, and we just ignore those guys. We think they're just delinquent kids. But reality, they probably have a lot of stuff going on at home. Domestic violence, there's some significant trauma, and it's just a heck of a lot easier to put your head down and ignore everything else that's going on. And so I think sometimes we forget about kids like that, or we forget the kids that are just not showing up to school. We forget the kids that, you know, if you're DSS and you show up to the house and the kid's just not there, you don't, where the heck is the kid at? That's why I'm here to check and make sure everything's good. They're hiding from you because there's other stuff going on. And so give us a call. We'll do our best to help. There's definitely those check boxes we have to hit for intensive in-home to prove to Medicaid why they need the service. We have to justify it. But there are some ways that we do try to work around it. So if you're DSS, and there's been several DSS phone calls, several DSS reports, you know, over the past 6 months or so, case management keeps getting involved. Give us a call. Mobile Crisis keeps going out there, and they've been out there 10 times over the past couple months. Give us a call. There's sometimes those kind of workarounds of, hey, these kids are just doing way too much to go to traditional outpatient. That's why they need me to go out there, and we'll stabilize that crisis. We have 23 teams that serve 7 counties. 5 of them, though, are designated to Onslow County. So just want you guys to be aware of that. So if they're moving to a different area, feel free to still give me a call. It's mainly in the southeastern part of North Carolina that we serve. We do have a Pender office that does traditional outpatient, traditional groups, medication-assisted treatment. So if these are kids or adults too that want to come to traditional outpatient, they can come to our Burgaw office. And also in Burgaw, and it gets a little confusing as well, there's a Child First service that you guys have here as well. I feel like it's a very underutilized service. It's a 0 to 5 population. Easter Seals has it here in Onslow County. We have it in Pender, New Hanover, and Brunswick. So if your kids are coming to those counties, again, give me a call. Somebody back there was telling me that they work from womb to tomb. I told her I was going to steal that. Coastal Horizons does work essentially from birth to death, and that's what we're here to do. So come back there, meet with us, ask questions. You can call me at any time. That's kind of how we operate, is through phone calls and emails. Dan Witten was here, Onslow Collaborative, so just make a plug for that. I saw him walk out. If you didn't get one of these, you can steal mine because I go. But it's the first Monday of the month, 9 to 11 at the new DSS building. So it's just a good community meeting for everybody to attend. Thanks.
Good morning. It was so nice talking with y'all over at the table. I'm from the Onslow Pregnancy Resource Center. I'm the development director. How many of y'all heard of the Onslow Pregnancy Resource Center? Okay, good. I still got my work cut out for me. It's kind of a new position. We exist to help families with unplanned pregnancies so they can have the option to choose life for their babies. Many women feel like abortion is the only option in this uncertain world. Many face the challenges of financial problems, emotional, and other limitations. that lead them to believe that they're not up to the task of being a mother or a father. We help them talk out their fears, share with them all their options so that they can make an informed decision on what they want to do for their future. Because everybody knows how hard it is if you're not sure about what decision you're making to come to terms with your feelings. All our services are free and confidential. We offer pregnancy tests, ultrasounds, personal counseling, parenting classes, and a fatherhood program. We also refer them to any resources out in the community that they need. Our Earn While You Learn program is for those families that need financial help. They earn points from taking classes and doing their homework, and they get to come in and buy much needed baby items from our baby boutique. Also, abortion affects women differently, and a lot of them suffer from their decision. So for those women, we also offer a post-abortive support group. All right, thank you.
Hello everyone, my name is Jessica Barbie. I'm the Intensive Alternative Family Treatment Therapist at Integrated Family Services based out of Greenville, North Carolina. I'm here today to talk to you all about our foster care program that we offer. Nervous. So with our foster care program, we offer therapeutic foster care as well as intensive alternative family treatment foster care. In North Carolina, we have approximately 10,000 children that are seeking those services, so we do need an increase in foster parents for their agency. The foster parents, we would just require that you be at least 21 years old. They do have to complete a number of background checks as well as state-mandated trainings. Our children are generally between the ages of 6 and 21 years old. They come to us oftentimes with a history of abuse, trauma, and neglect, as well as a number of mental health diagnoses. All referrals are sent to and screened by Kenyatta May, Foster Care Director, and that is our table down there to the right. If you have any questions or anything like that, feel free to come to our table when we're all finished, and we'll answer any other questions that you may have. Thank you.
Good morning. My name is Haley. I am the supervisor for Onslow County Mobile Crisis with Integrated Family Services. Before I kind of jump into my little spiel here, has anybody utilized our mobile crisis team or made referrals to our mobile crisis team? A couple of you? Okay, perfect. IFS has been providing services since 2003. We do provide an array of services. Here in Onslow County, we provide mobile crisis. We provide outpatient therapy, which we can do face-to-face or via telemed. And we also offer medication management for our mobile crisis clients, and that is through telemed to our providers at other locations. For the mobile crisis, we provide coverage 24/7, 365 for anybody in a mental health, substance use, or intellectual developmental disability crisis. Our agency believes in a self-defined crisis. So that can be something as simple as depression or anger, history of trauma, anything like that, or it can be something as severe as threatening to hurt yourself, hurt somebody else. My team, I have 5 people who are on Monday through Friday, and then of course at night as well. So anytime anybody calls, somebody will be dispatched to that call. We do have 2 hours to respond. I can guarantee you that it will never take somebody 2 hours to meet you where you are. We will get in our car and we will drive to wherever you need us and be there as soon as possible. When we get to a call. We provide crisis stabilization, crisis intervention, and crisis prevention. We will do an assessment on the individual. We always consult with our clinician about recommendations and diagnosis. From there, we will link them with needed services. We will continue to follow up with them, and during that time, we work to break down any barriers that continue, that keep setting people into a crisis. It is available to anybody of any age, and it is available to anybody of any insurance. We are funded through Medicaid, state funds, as well as some private insurances. However, the client will never have to worry about having to pay a bill. If they're not able to afford that, we do have the state funds to be able to cover that. So I make sure that everybody is aware of that, because we don't need financial stressors adding to their crisis. One of the last things, when you need to call to make a referral for a mobile crisis, you'll just call the 1-866 number on here. You'll talk to a live screener. They'll just get some information from you, make sure we have consent from the client, and someone will be dispatched out to talk with them. We also have our crisis chat. You just go to our website, www.integratedfamilyservices.net. You click on chat with us. It's in the upper right-hand corner. It will pull up like a Facebook Messenger. They can talk with somebody 24/7. So this is, focused primarily at our teenagers, but anybody of any age can use it. If there is concern for safety, they can dispatch mobile crisis out as well. So if you guys have any additional questions, or you need RAC cards or anything like that, just come see me and I will get you guys what you need. Thank you.
Good morning. My name is Lisa Mobley. I'm with Onslow County Senior Services, Consolidated Human Services. We have many things to offer for our senior population. We serve the population of 55 and over. We have our in-home program, which provides an aid to a senior's home to assist them with their personal care, their bathing, their household chores, preparing them a meal. That is a grant-funded program. We also have CAP, which is a Medicaid-funded program. We have home health and hospice at our location. We also have an adult daycare, which is like dropping your child off at daycare, but it's for 55 and older. We have 4 nutrition sites in our surrounding area of Onslow County: Richlands, Belgrade, Swansboro, Sneads Ferry, and our main location at Richlands Highway. We have a fitness program, which exercise equipment. We offer aerobics, Pilates, chair exercises, all kinds of fitness programs. We have classes. We have our Living Healthy with Diabetes class, our Matter of Balance class, our Living Healthy with Chronic Disease classes, and we offer Tai Chi class. We have support groups. We have our Alzheimer's support group. We have our diabetes support group. We also have different kind of clubs they can join. We have our wood carving, our crocheting club, art painting, Bible study. We do bingo on Friday, which is a big thing. We have about 100 participants that come out every Friday for bingo. We take trips. We take senior trips. We're going to Ireland this year. They're going to West Virginia, so some of our trips are kind of elaborate. We are having an elder abuse awareness walk June 1st, and I do have information regarding that at our table over there. If you have any questions, you can call us at 455-2747 for more information about senior services. Thank you.
Hi, I'm Dawn Wren with Coastal Carolina Neuropsychiatric Center. I'm an outpatient clinician, and I'm also our community and military liaison. We offer medically necessary evaluation, medication management. We have an outpatient Suboxone treatment program. We also offer psychological testing and then individual, group, family counseling. We accept most major insurances and self-pay. If an individual is interested in services, kind of depends on their insurance whether or not they need a referral. They will need a picture ID their insurance information. They can call us to find out if they need a referral. And if there's a custody or guardianship arrangement, we will need copies of those papers. Also, if there's a guardian ad litem, we need those papers. The only other thing I want to touch on is we have our annual PTSD awareness event coming up June 16th from 9 to 11. I have flyers and I need vendors, so if anybody's interested, come find me, and we'd love to have you. Thank you.
Morning. My name is Arian Davis, and I'm an advocate at the Child Advocacy Center. So we evaluate children birth to their 18th birthday for allegations of physical abuse, sexual abuse, or serious neglect. The only requirement is that there is an open investigation with either law enforcement, we work with 10 different districts, or Child Protective Services. So last year, in the calendar year 2017, we saw 272 children. They all reside in Onslow County. Of those, 213 were for sexual abuse, 42 for physical abuse, and 52 for serious neglect or other, so they could have been witnesses to serious crimes. Of those 272 children, 70% are female and 30% are male, and the majority that we see falls in the 6 to 12-year age range. So when a child comes to see us, we offer forensic interviews starting at age 3 and up until the day before their 18th birthday. And it's just a safe place to come talk about terrible things that might have happened to a trained professional who is prepared to accept that information and ask follow-up questions to get whatever the investigators need for their case. We also offer comprehensive medical exams, and that is from birth until their 18th birthday. The youngest we've seen is a 12-day-old for physical abuse, and the oldest is literally 2 days before her 18th birthday. Again, it's a safe place to come. You leave there knowing that your body is safe and healthy, and that's the goal. We do evidence collection, but that is not very typical. We don't do very many sexual assault kits in a year, but we do have the capacity to do that and test for STIs and pregnancy. We also offer advocacy, so we give a lot of resources to families. We answer a lot of questions that are specific to the appointment, but also we kind of zoom out and focus on their entire life, because if you don't know where your next meal is coming from or where you're going to sleep, how can we assume that you're going to be able to take your child to therapy and get them into those programs that they really need? So we do a lot of referrals to peers, places on base, but the biggest thing we discuss with parents is therapy, and we're happy to say that we are growing our trauma-focused therapy in the area so that hopefully more of our children can get those services quicker rather than having to wait. We always offer a team approach, so we partner closely with our investigative services, but also different programs in the community, peers on base, the schools, the DA's office. We all meet as a multidisciplinary team, and we come up with the best approach for that child because the child is always our main priority. I think the last thing just to quickly touch on is that we're also trying to grow our prevention efforts. So as we do that, we ask that you guys become advocates for that, trying to get programs in the school. We're showing the film Resilience. We're talking about adverse childhood experiences because awareness and education really does make a difference. And our hope is that a child doesn't have to walk through our doors. So if you want any more information, I'll be at the back table, and I'll be happy to chat with you guys. Thank you.
I don't want to be too close to this. Is this good enough? Okay. I'm Kaja Williams. I work for the Department of Social Services with the Economic Services Division. We're located in the new Consolidated Human Services building on 612 College Street, 3rd floor. In the Economic Services Department, the programs we handle would be food stamps, Medicaids for family and children and adults, cash assistance, medical transportation, and your energy assistance programs. These programs are income-based programs. I want to first say
if you have clients that have a need, always encourage them to apply regardless of what they may think their income situation is, because we would have to do a full interview and look at all of possible deductions for Medicaid, whether or not they have medical bills that are unpaid to help them meet a deductible to get them eligible. So if you have a client for any of your programs that have a need, always encourage them to apply, no matter what they think their situation is. Because a lot of times with food stamp programs, regardless of the allotment that you're eligible for, whether it be $4 or $15 or $600, the fact that you are eligible for that program or a Medicaid program opens doors for you to be eligible for other types of assistance. Somebody said earlier, like the WIOA program, or if you do have a $4 food stamp allotment, that does make your child eligible for a free lunch program. So you always want to encourage people to come in and apply. The methods to apply, a lot of people don't want to come into our agencies. They can apply, they can call in and request that a mail-in application be mailed to them, and they can mail it back to us. We put in a return mail envelope in there if they don't have access to a computer, or they can apply online with at epass.gov. They never really have to come into the agency to receive their benefits. If they have a food stamp application, they do have to complete an interview, so they do have to have phone access because we do have to talk to them. If they don't have to come in for food stamps or Medicaid. If they do need to apply for other programs like the energy assistance or the cash assistance, they would need to come in and speak with somebody directly for those programs. But to apply for food stamps and Medicaid, they can do it online or by mail. That's really all I have today. I'll open it up to my director.
Well, I'm going to try and talk really fast, and I'm pretty good at it. So the other side of the house with Department of Social Services, you've heard from Kaja who talked about economic services. We also have social work services. In social work services, we're broke down into multiple areas. We have child welfare, we have adult services, we have Peers Family Development Center, and we have youth services. Youth services is a program that works with children that have issues. They're either delinquent or they're pre-delinquent, and they operate out of Georgetown Road. We get most of the referrals for that program through the juvenile probation officers. Peers Family Development Center is a program that is also a nonprofit, as well as being under the DSS employment umbrella. Peers has a program for pregnant or parenting teens who wish to stay in school. Their goal is to get them a high school diploma and then to help them look toward a better future for themselves and their child, all the while preventing child maltreatment and preventing a second pregnancy. We also have parenting education classes there. Those parenting education classes are for everyone. Anyone can attend them. We do have some specific classes and some specific focus on families that have already come into contact with the Department of Social Services and trying to work on how to make that not happen again. They also have a child care program. It is 3 mornings a week, Monday, Wednesday, and Friday, and they provide free child care during that time frame. So Peers is part of our umbrella. Adult services, many folks are not aware that there are programs for abused or neglected adults. If you call the Department of Social Services, if you have a concern about a disabled or elderly adult and how they're being cared for, you can call the Department of Social Services and make a report. This also includes exploitation in the adult services realm. So if you know that so-and-so gets a check and somebody comes and takes their check from them every week and is not giving them any benefit of that check, that's kind of in a nutshell what exploitation is. And those things can be reported and investigated by our social workers. It's important to remember that with adults, They have a right to make poor decisions. So you may see an adult living in a situation that you think is absolutely awful. It may actually be absolutely awful. But if that adult still has the capacity to make a decision where they know the consequences of their actions, they get to make that poor decision and stay in that situation. So it's important to remember that they have that option. Now, sometimes folks don't have the capacity to make those kinds of decisions, and we also have guardianship programs. A guardianship program is a court action whereby someone is assigned a guardian of the person, a guardian of the estate. Someone will make all of their monetary decisions for them, and someone will make all of their life decisions for them. And the department acts in that role as a disinterested public party. We try not to be put in that role. We try really hard to find family or friends that can take on that role, but we do find ourselves in situations where there is no one else to take that. So that's another piece that's offered through our adult services program. Then we have child welfare, which is kind of the big bugaboo. If you have a concern about someone's treatment, the state of North Carolina actually has a law which says that everyone is a mandated reporter. You hear from folks, from different states, I'm a mandated. Everyone in North Carolina is a mandated reporter, and the law specifically says if you suspect child maltreatment, meaning you don't have to have any proof, you don't have to know for sure it's occurring. If you think, should I make a report? The answer is yes, because obviously you're suspecting at this point that there's something going on. So you call our intake workers and you make that report. They are the experts in what is child maltreatment in North Carolina. There are 4 standards they have to meet. 1, the child must be found in Onslow County. 2, the child must be between the ages of 0 and 18. We do not do prenatal. 3, the perpetrator or the person committing the act has to meet the legal definition of parent or caretaker. And 4, the act being described has to meet the legal definition of abuse, neglect, or dependency. Those things are very important. If you don't meet one of those, then it's not a case for the Department of Social Services to investigate. That doesn't mean we won't refer it elsewhere. So, for instance, if the child is not found in Onslow County but is over the line and in Carteret County, we're going to contact Carteret County and make the report in Carteret County. Or if the perpetrator is not a parent or a caretaker, but the guy down the street punches your kid in the face, then we're going to make the report to law enforcement because that's assault and it's a crime, and law enforcement's going to take on that case. So just understand that we don't just go, oh, it's not us, and move on. We do refer those cases on. Once a case is accepted for investigation, we have to see all the family members within the first 24 hours of that, and we do an in-depth investigation. We utilize those services in the community, such as the CAC, anyone in the medical field, the schools, daycares. All of those help us make a decision on whether a child is being maltreated in their home. Once we have the decision whether the child's maltreated, if the maltreatment does not rise to the level that requires foster care, then the child receives treatment in their home, their family receives treatment through in-home services. If the child is found to be at imminent risk, meaning that if we leave the child in the home, that child will be harmed, then that's the child that comes into foster care. The thing I want you to hear is that it's not a Department of Social Services decision all on their own. That what happens in those cases is a social worker will have gone out, done her investigation, found that the child's at imminent risk, go talk to their supervisor, go talk to an attorney. At that point, a petition is drawn up, and we have to get the judge to sign off before we can remove the child. So that is a judicial decision, and your due process begins at that point, going through the court system. I think my 5 minutes is probably up, so if you all have any questions, I'll be here later.
Good morning. So I'm Michelle Brewington. I'm the community liaison for Bryn Mawr Hospital. Share a little information about Bryn Mawr with you. We are an inpatient psychiatric hospital, founded in 1983. Been around a long time. So Bryn Mawr services children starting at the ages as young as 4 years old. That is 4 to 12. And then we also offer an adolescent program, 12 to 17, and then adult, 18 and up. We also have a gender-specific program. It's a residential treatment program for female girls, and that is it's called Passages. We accept all major insurances and most managed care plans. Bryn Mawr offers a short-term crisis assessment for anyone that is experiencing acute behaviors due to a mental illness. It's a structured environment. Bryn Mawr utilizes recreational therapy, pet therapy, music therapy, so everything is structured throughout the day. With the Passages program, that is directed towards girls who are showing behaviors due to a mental illness, and that is more long-term residential care. That's 120 days length of stay. What's the other point? Also, with the Passages program, Bryn Mawr offers an accredited school through the program so they can graduate and get a diploma, not a GED. And lastly, Bryn Mawr accepts involuntary and voluntary patients from any mental health entity, families, physicians, and managed care plans. Questions? Please direct them to me later. I have brochures and business cards as well. Thank you.
All right, guys, so that is the end of our second round of presentations. I have been asked to let you guys know that there is a Community Child Protection Team Health and Safety Information Expo. It's going to be May 30th from 9 to 2 at College Street, 612 College Street, and there's going to be Dolly Parton Information Library there, stuff about resilience, parent education, safe sleep information, hands-only CPR, stop the bleed, and car seat and WIC information. So if you have questions about that, you can come back and see me, and I'll refer you to who you need to talk to. Also, somebody did leave a bracelet in the bathroom, so if you find that you are missing a little jewelry on your arm, just come back and let me know. I'll be back at the table. And we will reconvene for our last round of presentations at 11:30, so you guys can just feel free to network some more, and then we'll come back at 11:30, and I'll give you a 5-minute warning again. All right, guys, so we're going to come back together. We're going to have one last round of presentations, and then we're going to wrap up for the day. So now I am going to hand it over to our next presenter, which is Stacy from C&G Counseling.
Hi there, my name is Stacy Hitz, and I'm here representing CG Counseling and Consulting. CG Counseling and Consulting is a veteran-owned mental health therapy office conveniently located in downtown Jacksonville. We currently have 7 therapists on staff who are all trained in a wide variety of therapies relating to couples and individuals, anxiety, depression, PTSD, eating disorders, suicidal thoughts, family stress, and so much more. We offer counseling for adults and children, teens, as well as families and groups. Our therapists have been trained in cognitive processing therapy, also known as CPT, which is the gold standard designed to treat PTSD and sexual trauma in adults. Our therapists have also been trained in trauma-focused cognitive behavioral therapy, also known as TF-CBT, which is the most well-supportive and effective treatment for children ages 3 to 17 who have been abused and traumatized. We offer groups focusing on social skills, encouragement for women, as well as nutrition. Currently, we have a new deployed spouses support group available for military spouses, and we have flyers with more information available on that over at our table if you're interested. Our office knows that there is a need for later appointments due to many working and school-aged families. We happily offer extended hours to suit those needs. Our office is open Monday through Thursday from 8 a.m. to 8 p.m., Fridays from 8 a.m. to 5 p.m., as well as Saturdays from 8 a.m. to 3 p.m. CG Counseling accepts most commercial insurances, including TRICARE, Blue Cross Blue Shield, Aetna, Cigna, United Healthcare, Military OneSource, and many more. A more extensive list of insurances we accept can be found on our website at cgcounseling.com, but we always encourage anyone to call our office to ask questions about insurance. We offer a sliding scale for self-pay clients as well if we're not able to accept a particular insurance. CG Counseling does not offer medication management at this time. If a client needs medication, we reach out to our network of skilled providers for that service. We encourage everyone who is interested in our services to call and schedule an appointment with our wonderful front office staff. There's no waiting list, and we're usually able to get a new client scheduled within the week due to how many therapists we have available and our extended office hours. Our building is handicap accessible and also accessible by a variety of different bus systems to make getting to an appointment as easy as possible. We offer a friendly but professional environment for all our clients and look forward to continuing servicing our community with effective therapy, treatment, and support. Thank you so much for listening, and if you have any questions or would like any additional information or materials, I'll be over at our table to talk.
Good morning, everybody. So I'm not much of a podium person. Can everybody hear me? Yes. All right, you can tell I've worked with kids before. So Susan Baptist, the Director of Recreation Services for the City of Jacksonville. I am so thrilled to be here this afternoon. I have a lot to share with you. I won't get to all of it, but I have some lovely staff over here that have more answers for you should you have any. So a real quick show of hands. How many of you played on some sort of sports team? All right, good answer. How many of you had kids or nieces or nephews? Perfect. Okay, keep your hands up if they've ever been to a rec center, played in a rec ball game, been to a camp, an overnight camp. I like it. Very cool. Well, I won't put you on the spot and ask if all of those programs were with us, because that's okay. As long as they were involved in something, that's all that matters. So real quick on the short note, school is fixing to get out. And we all know that because we're all, I'm sure, dealing with kids and parents on some level. But they're going to be out for the summer. And we have a huge array of programs for these kids to be involved in. One of my personal goals is that kids are not sitting at home, playing video games, eating and drinking stuff they shouldn't be doing. We want them out. We want them active. We want them play. I want them in nature, honestly. How many of y'all played until the lights came on? I don't think they do that anymore, but I would love for kids to play in nature. But if not, I want them to come to a rec center. I want them to be in a day camp. I want them to be in a program where they're socializing, engaging, learning, all of those fabulous skills. So we have a whole array, and I won't go over the details on all of the many camps, programs, ages ranging from your 3-year-olds all the way up to your teenagers. So we have it all over at the Recreation and Parks Department. We also have swim lessons. We also have a whole array of sports, youth sports, everything from basketball, volleyball, baseball, softball, you name it. We have lots of that going on. And then if that's not enough, we do have a senior center, an adult center. They do lots and lots of activities similar to senior services with the county. We have lots of trips, activities, programs, just social skills. We want our adults to be social. We don't want them sitting at home, same with kids. We don't want them sitting at home being bored and lonely. We don't want that for our older population. So we want them to come out to our senior center and just talk to people. Hang out, play some cards, you name it. You would be surprised at what that little interaction does for somebody in their 70s or 80s. That little bit of interaction can really help somebody carry their day on and carry their week on if they don't have family nearby. So we have senior center, we have lots of special events. We have lots of great programs all summer. I know you guys have all heard there's nothing to do in Jacksonville. It drives me insane, but we won't go there because there's lots of things in Jacksonville. But you have to look for it, you have to go get it, you have to participate. So we have, starting this Friday night, correct? This Friday night, all the way through the summer, we have movie nights, we have concerts, we have a new amphitheater fixing to open up. So we have lots and lots of things that we offer, and it's completely free. I'm fortunate to work for a city council that feels like these are added values to our citizens. These are things that we want people to engage in because family memories, quality time helps the family unit, and you all know a better, stronger family unit helps the kids, and we all produce better citizens in our world, and life is fabulous. So we want to engage them. So we have special events, lots of programs for kids. We have splash pads opening. So we have 2 splash pads, one at Northeast Creek. So and want to check them in. And we also will be operating a public pool for the citizens this summer at Holiday City Mobile Home Park. It is just like $1 for a child and $2 for adults. So, long and short of it, I think I got the signal back there. I could talk on and on and on because I am extremely passionate about what we do. We're very broad. If you have any questions, please do not hesitate to reach out to us. These lovely ladies can answer anything and everything for you. But pick up our brochure if you want more for your agency. Please take them. It has so much more in here that I could have done in 5 minutes, as all of you could do the same too. So, okay, that's it. That's my 5. So, thank you.
Hey, good morning, everyone. Can you hear me? Yes. Okay, I also work with kids at one time as well. My name is Darryl Witt. I work with the Exceptional Family Member Program on Camp Lejeune in New River. This program is a Department of Defense-wide program. It's designed to serve active duty service members that have a child or a spouse or any dependent with any sort of specialty care need. More specifically, a special medical, psychological, or special education need. Diagnosed need that requires someone to see a specialist. If that's the case, they have a dependent of that, it's required that they be enrolled in this program. This program is designed to ensure the continuity of care for that family. We know Marines transfer duty stations frequently, and this program is designed to ensure the care is available for that family member whenever those transfers occur. So we break it down for Marines, and we tell Marines the simple way to know if you're supposed to enroll in this program is your child or your spouse or any of your dependents seeing a specialist. Then you have to be enrolled in the Exceptional Family Member Program. So our diagnosis is much broader than most people realize. A lot of people associate us with autism or Down syndrome or major disability. It's really, our top 5 are things like asthma and allergies, anxiety. A very simple diagnosis that the Marine Corps cares about. They want to make sure that that family is well taken care of so that the Marine can focus on the mission. Right? So those simple things also make it mandatory for a Marine to enroll in our program. How do you enroll in EF&P? It's a simple Department of Defense form that you take to the provider, either the medical specialist or special educator. They fill it out, turn it into our office. We forward it up to headquarters. The great thing about that paperwork, it's the same paperwork used to enroll, to disenroll. It's just one big packet of paperwork, right? That paperwork is actually crucial because the Marine Corps uses that to screen orders, to make sure that before they go to, say, Camp Pendleton, we'll call and make sure that the specialty care they need is available. We'll actually call and make sure that appointments are available, that they accept TRICARE. All those kinds of things are set up. Multiple benefits of being in the program other than just following orders. We have 8 caseworkers here who will work one-on-one with families, ensure that they're accessing state and local resources, connecting them with events, those kind of things, and supports in the local community. They also will sit with these families on special education meetings and advocate, help explain terminology, those kind of things, take some pressure off of our families. There's respite care for our families with the highest level of need, so 20 hours of reimbursed child care is available for these families to give that caregiver a break. There's extended care health option, which is just basically additional insurance for things that TRICARE may not cover all the way, such as therapies for autism or durable medical equipment replacement. So there's a lot of benefits to being in the program. One of the great benefits is the networking that our program offers. We have great events. I say great because me and Barbie plan them, so we think they're awesome. But we got some great programming that we offer these families for them to make connections within the community or just enjoy some of the social things that we offer. We have a location at Midway Park in Camp Lejeune area, and we have an office at New River. I hope that you'll connect anyone that you're serving. You realize that, hey, you probably qualify for this program. Please connect them with us. We really want to serve our military families. Thank you.
Good afternoon, everybody. How are you? My name is Dandy Alexander. I am the Executive Director of Onslow Literacy Council. So, a fact that you may not know, the illiteracy rate here in Onslow County is almost 20%, which is very high. It's even higher in Duplin County. So chances are the children you work with, a lot of their parents probably can't read or write. Most of the adults that you meet, a good percentage of them are probably illiterate. And they have adapted very well and a lot of them probably will not share with you that they are illiterate. So what we do at Onslow Literacy Council is provide free tutoring to adults ages 16 and up here in the community. We offer basic reading starting with phonics. We offer basic math. We can go up to 12th grade level math. It depends on what tutor we have available at the time. We offer writing. We can offer specialized classes. If a student is taking a college class and they just need help with that specific class, we can tutor them with that. All of our tutors are volunteers. We are an entirely volunteer-run program. So we also teach English as a second language. So our community is very varied because we are a military community. We see a lot of people who don't speak English. We are capable of teaching them English. Over the last couple of years, we've really tried to expand our program to reach a more wide variety of students. So we've started incorporating some field trips. So we can help students get their driver's license. We can help them study for the test. We can take them to get their test, and we can also help them get their citizenship. So we do not provide the test, but we can help them with the interview. We have specialized curriculum for that. We can help them study for the citizenship exam itself. We have also started taking some of our students to grocery stores. A lot of our students don't always know how to read labels. They don't know how to find the best sales, etc. So we can take them, show them rewards programs, walk them through the store. We can help them determine how to make a meal plan or a grocery list. So basic things like that, as well as education like learning how to read, learning how to write. So we are located on Huff Drive, right next to the fire station. We also are partnered with the volunteer fire stations and also the county library and Coastal. So in the event that a student needs to meet later in the evening or on the weekends, Coastal will provide a place for us, the library will provide a place, and we are located right next to a bus stop, which is very convenient. So we're on Huff Drive, right next to the fire station at Valencia. I do not have a table, but I will be lurking next to the blank canvas awareness art because Donna Gargett is also someone we partner with. So if you have any more questions or would like to learn more, you can come see me there.
So we partner with Andy quite a bit. My name is Donna Gargett. I'm the founder of Blank Canvas Awareness Art. What we do with literacy is a little bit different. Our focus is with dyslexia, ADHD, and ADD. We do service adults and children. And what we do, because it is specialized, we are still charging for those services at this point. But we are using a sliding scale to do so. Dyslexia affects 1 in 5 people. And so, as Dandy mentioned, a lot of our parents in the community are struggling with dyslexia. And so when they're advocating for their children, it becomes a very difficult process. So what we do is help them through the complete process. When we receive a phone call, most of the time it's because the student is falling behind in the school system, or there's some difficulty somewhere within the school system. You don't have to have a qualifying diagnosis to use our services. Again, we will help refer you based on insurances. I've partnered probably with many organizations in the room right now. We also provide education to the community. And so I challenge you guys to contact me to see if your organization can pass the test, if you know what dyslexia is and can dispel the myths. Basically, I will give your organization kind of this true and false test to see where you're at, and then we're going to stomp out those myths about dyslexia. The only way we're going to solve it is through education. And so, again, another way that we do that is through providing awareness art shows. And that's where the art comes in. So if you visit our table, you'll see a couple pieces. We have a traveling art show right now. We have in Wilmington at a museum. And so we've been able to connect with not just children, but with people from all over the world, adult dyslexics. And so it's very exciting. Again, I will ask help because we are growing so much. We're looking for tutors. A lot of our tutors right now are teachers, and they're looking to help their students to learn something specialized. And so we also mentor with our teachers to help them learn through the process. A lot of our teachers are looking for ways to make more income with tutoring. And so we're basically a stepping stone. We built into our program knowing that we're in a military community that people are going to be filtering through. And what a great way to really solve dyslexia and to spread the word about solutions. So that is basically the nuts and bolts about our program. I'll be at the table if you guys have some specific questions. Thank you.
Good morning. I'm going to use the podium. I didn't work with kids, but I did work on jet engines, and either my pitch is going to be really loud or really low. So again, my name's Jarek Vernon. I'm the NC Serves Coastal Program Director at Eastern Carolina Human Services Agency. I'm right here in Jacksonville. We have offices in Duplin and New Hanover County, and our mission is to improve the lives of low-income veterans and military families by empowering them to become economically and socially self-sufficient. Who are we? We're a nonprofit community action agency that provides services to families in 20 counties along the North Carolina coast. We currently administer 3 programs, starting with the youngest of our programs, NC Serves Coastal, which it's part of a statewide initiative that improves the way that services are delivered to our military and veteran families in 20 counties on the coast. We do this by bringing community providers such as yourself together under one shared software platform that allows the community to make referrals and track outcomes without letting these families fall between the cracks like you know some of them do with our traditional referral process, handing those cards, having them fill out a referral form. You truly don't know exactly what's happening to that family once you send that referral. The value proposition with that program, for veteran and service member families, is better access to services and simpler navigation of resources. For network providers such as yourself, we break down barriers and provide a database of information. For funders, we provide impact measurement and scalability. We all know money is super important. Utilizing the software will allow you to pull all types of reports and see who you're serving so you can then present that information to those funders to encourage more funding. To join the network, it's free. To families, it's free to the network providers. And to join, all you need to do is give me a call at 910-347-2151 or visit us at ncserves.org. Before I get the hand, I'm going to go really fast. It's going to sound like a commercial, I know. But truly, what we do is we issue one challenge to our network providers. Just continue to provide the services that you're good at. For the services outside of your scope, just make the referral in the network and watch how your community with NC Serves coordinates care. The other program that we have is the Section 8 Housing Choice House Voucher Program. It's the federal government's major program for assisting low-income, the elderly, veterans, and the disabled to afford decent, safe, and sanitary housing in the private market. Programs under the Section 8 housing umbrella include mainstream program for persons with disabilities, home ownership program, veteran affairs supportive housing program. A lot of you know, may be familiar with the VISH program. It's those vouchers. The other program that we have is a community, there was my hand. Community Service Block Grant Program, which is a family self-sufficiency program that helps low-income families become self-sufficient. They do that through comprehensive case management services, or other services are provided according to need for employment, education, and financial assistance. For more information, contact us again at 347-2151. You can visit us on the web at ECHSA.inc.com. Our central office is right here in Jacksonville at 237 New River Drive, Suite 1. And I hope to hear from some of you because we're only as strong as the network that we build. Thanks a lot.
Yeah, I'm going to use the podium too. Don't want to talk too loud. All right. Good morning, everybody. My name is Justin Gibson. I'm a social work intern for Hope for the Warriors. I just want to share a little bit of information about who we are and what we do. So Hope was founded in 2006 after witnessing all the impacts of the recent wars in the Middle East and the impact that it was having on our service members and their families. This organization is dedicated primarily to post 9/11 veterans and families. It works with both veterans and active duty. That's all branches, so ranging from Marine Corps, Navy, Coast Guard, Air Force, and any other ones that are in there. We cater to all of them. Since the time of its foundation, this organization has expanded, and it does now offer several different programs to better assist our service members and their families. Some of the service offered are the transitional, health and wellness to include clinical support and family caregiver support programs, sports and rec, and then finally community development. We have two separate locations. One is located on Camp Lejeune, whatever you want to say, and the other is newly opened on 3215 Henderson Drive. That's just a little bit ways down from Gold's Gym and the VA over there. Since my time here in the organization, I do want to share a little bit about insight. I have watched the impact and how our organization can benefit veterans and their families. So I've watched the lives change, and it's amazing to see what we can do whenever we put our minds together and, assist these individuals who are struggling. If you know anyone who does need assistance in learning how to apply for services through organizations, please feel free to get up with me or my two wonderful ladies back there in the back. And we do have some information over there on the table. We just want to point out that 86% of the funds that do come into our organization go straight back out to the veterans and the families. We understand how much of a struggle it is, especially for individuals who are transitioning out of the military in especially that first couple of years. So we just want to point out that we are here for help. So with that, I'll close. Thank you.
Thank you all for staying. I know being last, it was like, oh, how many people are going to still be there? I'm Debbie Burns, and I'm the Clinical Supervisor for Prevention and Education. We are a branch of Family Advocacy Program. And our whole purpose is to train folks with coping skills, life skills, anger management skills, skills on skills, so that they do not wind up either abusing their child or any domestic violence. We work strictly with Department of Defense families, such as active or retired military. You have to have a military ID in order to be able to participate in our programming. But all of our classes and all of our trainings are evidence-based. We're very strict about making sure that we have all of that research to support that we are truly doing only the best, what we can for our service members. And being just a part of Family Advocacy Program, I do want to mention that Family Advocacy Program provides treatment for families that are involved with either child protective services or have a domestic violence charge against them, et cetera. So we work very closely, and sometimes the classes that we provide are used as an adjunct to treatment. Now, I also want to mention that we're a part of a bigger picture of the umbrella of behavioral health. And many times I'm hearing from folks that they didn't know these services existed. They didn't know that there was so much available on base for folks. So I wanted to make sure that you are all aware that if you are working with a service member, that service member has so much available to them. The Exceptional Family Member Program. There's all kinds of different classes on financial. There's all different types of programs for transition. There is community counseling program, which all of these are free if they are an active or retired military or what is known as a dependent, or which is a family member of that service member. So please be aware that if someone is connected to the military, more than likely there's something out there that they can use that will cost them nada, nothing. It's part of their benefit package for being in the military. So if you have any questions, comments, or concerns, please come in and see me over at the table. We just finished with our collaborative effort with Onslow County Partnership for Children. We provided the resiliency movie on base, and the response has been phenomenal. So I'm looking forward to continuing with our collaboration, as well as collaborating with some of you all. So thank you very much, and have a great afternoon.
Who's hungry? Yes. All right, I'm Dan Whitten. I'm the co-chair of the Onslow Community Collaborative. We meet every first Monday of the month at the Health Department from 9 a.m. to 11-ish. The 4th is our next meeting, and we'll actually be having a little bit of a presentation about CBD oil and its place in addiction and mental health treatment, and IDD as well. So that's kind of all I got to say about that one. The collaborative, so I passed out some little brochures earlier. We are about the business of providing all of you guys a platform to come. Tell us what's working, what's not working in your offices, in your networking, in the community. And what we do is we find solutions to those barriers. And we turn it into action plans, into policy, into advocacy with both city and the county level government. We are not politicians by any means. I might be, but that's about it. But we feel that it's important that you guys are on the front lines of our kids, our youth, and future leaders of this country. You see what's working, what's not working, and we need to make those voices heard to those who are in charge of making the rules and the policies. That's what we're about. We also provide education. How to be culturally competent in what you guys do, how to be aware of different things, new emerging technologies and ways of thinking. We do TEDx videos, and we have free Starbucks coffee at every meeting. So that should be enough for you guys to roll up into that office. So it's the health department downtown at 9 a.m. In that big room on the side with all the nice, beautiful windows and sunshine. We actually hosted the Oorah Vigil last year in October, Onslow Remember, Act, and Heal. That was a vigil for those who have lost someone due to overdose or suicide. We were on every channel of the news and reached about 200,000 people. And from that event, we were able to divert 4 suicidal individuals, 1 being military, to mobile crisis. That's 4, but that's a lot of people. So I wanted to just give you guys some numbers. I also serve on the Juvenile Crime Prevention Council, among other things. I want to give y'all a reminder of the scope of why we do what we do. In the school system right now, there are 308 students who are identified as homeless. 222 are doubled up with family and friends. 48 of them are in a hotel or a motel. 7 are at the homeless shelter. 1 is in a car, and 1's at the campground. Reasons. Now, this is important because we're all about root causes, right? That's how we solve problems. 6 to 7, economic hardship, and that's a give one. 60 of them are kicked out of home or abandoned by their parents or guardians. Now, that's just 60, but that's a lot of people. That's a lot of kids who are having those ACEs already, just cranking them all the way up. Say 65, domestic violence. 59 are evictions and foreclosures. 1 is a runaway, condemned housing, and just stuff like that. So that is the scope of our community. This is what you guys are doing. This is what you guys are passionate about, is helping these kids, helping these families, and serving our community. I'll part with this, and this little saying just reached to me, both mind, body, and spirit. Leaders do not just simply, well, hold on. Good leaders don't just simply tell you to support them or to follow them. Leaders inspire others to lead themselves. And what you guys are doing every day, because it's a tough job. I mean, who here has no tough job here? I mean, like, raise your hand. Okay. We are faced every day with the opportunity to inspire, to enlighten, to educate, and to empower kids and families who will not receive that blessing anywhere else. So first, thank you for what you guys do. I see you, mind, body, and spirit, and I appreciate all that you do for our kids, families, veterans, and our community. Remember that you guys have the ability to change lives, and that's such a huge blessing. It's a huge job, and never forget that you guys have the ability to not just change lives, but to grow as a professional. So thank you for what you guys do. Whenever you guys wake up in the morning and look at your busted self in the mirror, just say thank you, and good job. Guys, stay amazing and stay blessed. Thank you so much.
Good morning. I'll be quick because I know most of you want to get out of here and go to lunch. My name is Lori McLean. I am the district administrator with the Guardian Ad Litem program for District 4, which includes Onslow, Duplin, Sampson, and Jones County. I did see some of my volunteers here. Are you still here or did you leave? I have one volunteer here. I had two more. They must have left. But thank you for being here and thank you for serving our program. Our program, what we do, we are a voice for children that have been adjudicated dependent by the court and they become wards of the court. We are completely volunteer run. We use volunteers to give a voice to that child. We don't give voices to the family. We don't give voices to the foster parents. We are specifically child focused. We provide training for our volunteers. We do not take the children at home. We do reports for the court, and we tell the court what the child wants the court to hear, and we also tell the court what we feel as a volunteer is in the best interest of the child. That is our major focus, is what is in the best interest. This year is our 35th anniversary. We have been set up by the General Assembly of North Carolina. 35 years ago, they decided that children in foster care needed a voice. So they created the the Guardian Ad Litem program, where we go and we are appointed by the court to represent these children. And we're always looking for volunteers. We ask for a 1-year commitment from our volunteers. We train you. We're getting a little bit more technology progressive, and we have a program where our volunteers can do part of their training online and the rest in the classroom. We have staff that supports our volunteers. We ask you to give 1 year of your time, and we ask you to make an effort to visit that child at least once a month. The reason is social workers often change. The child may go through 2 or 3 foster homes, 2 or 3 foster care workers. There may be changes in their life that they have no control over. So we ask our volunteers to be a solid person for at least 1 year in that child's life, to visit that child, to make contact with that child, and be an extra set of eyes on that child. So that's one of the big things that I ask my volunteers. Try to get out there once a month. That's best practices for what we do. Sometimes it's a little difficult because the children might not be in Onslow County. They might be in New Hanover County. They could be in Duplin County. They could be at a residential treatment facility somewhere. But we work with you to try to make sure that that child's seen. Thank you for all you do. I know there's a lot of service providers here in the room. Thank you. Thank you for anybody that gives their time and volunteers for children. I appreciate that. And I'm glad we could be here today.
Hello, I'm Tracy Yates with Onslow County Schools Preschool Program, and I am a family specialist. And with that being said, preschool is not just for the preschool student, it is also for the family as a whole, and that is part of my job. We have 4 programs that compose the preschool program in Onslow County Schools, so I'm going to explain just a little bit about each one. We have the Title I program, which is a federally funded program, educational program for secondary and elementary students. This child must be 4 on or before August the 31st of the current school year. There is an assessment given to each child to determine their educational need for Title I. And all students must live in Onslow County for the Title I program. Head Start is also a federally funded program, and it's for economically disadvantaged families. We serve 3- and 4-year-olds with our Head Start program, but they must be 3 or 4 on or before August the 31st of the current school year. We do have several preschool sites throughout the school system in Onslow County to serve the entire county. We also have the Exceptional Children's Program, and those students are served who have some type of delay that may affect their education. And they are evaluated, and they are also use a play-based assessment to determine eligibility for those children. And we dual enroll students for the NC Pre-K program in the school system. These programs are 5 days a week, except for the Exceptional Children's Program that is determined based on the team and the need of the child. They are a minimum of 6.5 hours a day. We do provide transportation for students to and from school and for families. They are served breakfast and lunch and a snack throughout the day. We do follow a curriculum. We use a creative curriculum in preschool. And again, as I said, preschool is not just for the children, it is for the family as a whole to hopefully ensure a good educational start for those children and those families. I have put some brochures back there on the table. We are located at Thompson Early Childhood Center at 440 College Street, and we take applications Monday through Thursday from 9 to 3. Thank you.
All right, guys, we've almost made it through the whole day. I know you're really excited to go. I'm just going to tell you a little bit briefly about what the Onslow County Partnership for Children does. We are a private nonprofit agency, and we advocate for the healthy development of children. We do this by building the strengths and capacities of families, early caregivers, and just the communities that we all reside in. We serve many different people, and we work with different agencies to do this. And our main strategic goals that we focus on are reducing and preventing child abuse and neglect, and also in increasing grade level reading proficiency. We do this through 2 main ways. We have 2 different program types and sort of divisions in our agency. We have programs that are geared toward family services, and then we also have programs that are geared toward early care and education. For our family services programs, we do have our Child Advocacy Center, which Arian has already spoken about that. This is a program that takes on a collaborative approach with the Sheriff Department, lawyers, medical professionals, and we serve and provide treatment services, training, and prevention for preventing child abuse and neglect directly. We also have our Early Head Start program, which is a comprehensive child development program, and this supports expecting mothers and also children up to the age of 3. It is a research-based program, and they provide home visits, they do social work, they do physicals, make sure that families have their well baby checks for their children, and also this is a program that is always looking for people. That program requires a wait list, and we try to reach out to social workers. We like to get the children that really need it the most, foster care children, military families, anybody really that can use that service, we like to have them. We also have multiple family support and parent education programs. We have Incredible Years, and there's 2 types of Incredible Years that we offer. We offer a basic program, and we also offer a research-based program that covers autism and speech delays. This, again, is an evidence-based parenting program, and it is this curriculum focuses on children that are 2 years to 8 years old, and it helps parents prepare for school and enhance their social skills. There are classes And it's a really great program where it's almost like a support program. They come in, sometimes there's incentives for them to complete programs. We also offer Triple P, which is comes in the form of multiple sessions. There's different levels of Triple P. There are one-on-one sessions, there are group classes, and there's also a seminar series that we offer. All of these are listed on our website. We have multiple kind of pages. We did just get a new website. And if you go to the Family Education and Parent Support Program, you will see all of these listed there. And this Triple P focuses on solutions for challenging behaviors. We all know that we're doing a lot of work around ACEs, which is adverse childhood experiences, and we do know that when children experience those things in life that happen, that sometimes that can show itself in challenging behaviors, and Triple P is a great program to address that, to help treat that child and family holistically so that we can make sure that they are really supported and that they can grow to become healthy and, you know, supported families and children. We also, another family support program that we have is Circle of Parents. This is a support group for parents of special needs children. It helps parents to discuss not only the challenges of having a special needs child, but also the successes. And it focuses on resources and information and also support that they can have, because that, as we all know, would be a very challenging experience to have, but you don't always want to focus on the negatives. We also want to build up and focus on the successes of being a parent and having a healthy family. And all of these parent education programs that we offer do offer on-site childcare and meals at no cost to the family. Our agency covers the cost of that because we do just want the parents to come and be informed and learn about the resources and information that they can have to be better and just have their family grow and be healthy. So the other kind of side of our house of agency programs that we have is, again, our early care and education programs. This includes, we have a child care resource and referral program, and this offers free services so that families can find quality education programs for their children. We do that through our resource center, which offers a lending library where families can come and check out toys and books and other resources. And we also have a workroom, which is included in our enhanced membership, where we get a lot of early educators that use that, and it's also meant for parents. Anybody, there is a small fee for that enhanced membership to that program, but they can work in the workroom and then also just come and have families come and play and use the resources that we have available. We also have our child care subsidy program, which is a great program that is meant for families who are working or in school to help subsidize the cost of child care. So the government actually pays for a portion of that. Parents have a parental fee based on their income. It is an income-based program, and again, both parents have to be working or in school to be eligible. But this allows families to be able to afford child care and also be able to work and support their family. We also have NC Pre-K, which offers 4-year-olds pre-kindergarten services in child care centers. We are partnering with the county for our application process this year, and we did that last year as well, so we do have like a universal application. I know that we have applications back there, so if you know of any parents of 4-year-olds, please get an application just on a flyer and just drop it off to them so that they can understand the services that we have for them. We also have 3-School, which is similar to kind of subsidy and NC Pre-K. It's kind of pre-K for 3-year-olds, and this one actually goes by, is income-based, just like our child care subsidy program is, and both parents have to be working or in school because of funding for that program. Our next realm of programs is our training and technical assistance programs. We have our CQEI program, which is the Continuous Quality Enhancement Initiative program, and this is where our TA staff will go out and they actually provide coaching and mentoring for the child cares and early education programs that are in the county. That way we can make sure that the places where our children are going to learn and grow and develop are actually going to be high quality, and they're actually going to get that learning and be prepared for school. With that, our training program, we offer different training opportunities and professional development opportunities that are actually going to be based on the state and region requirements that are set out by the Division of Child Development and Early Education, but also we cover topics that are identified from our TA staff that actually see it in the field and they observe what the need is, and then we make sure that we address that on our training calendar. Our training calendar is released every quarter, so it's a 3-month calendar that comes out. Our next program is our literacy programs, which you already kind of heard about, our Dolly, Parton Imagination Library. We also have little free libraries at random places. Well, usually it's parks around the community where families can just come by, pick up a book, drop it off. And we like to do that because we really want to instill the love of reading in children and families, and also that creates a lot of family bonding time for families. We also have our LEAD program, which is our 21st Century Community Learning Center. This is an after-school learning center at Northwoods Elementary School, and this provides academic enrichment opportunities for children. They do a lot of great things where they go on field trips. We have an outdoor learning environment at our technical assistance building that they go on, and they can plant seeds and just do a lot of things that just promote after-school care in a high-quality environment. We also have Safe Kids, which is a multidisciplinary coalition, and they are dedicated to injury prevention and making sure that the children in Onslow County are safe. We do a lot of fun things like we have events where we do like the hot car exhibit, where we make s'mores in the dashboard of a car so you can see how hot it actually gets in a car, and make sure that families are aware that it's not safe to leave their children in a car even for just a few minutes, especially with the weather being as hot as it has been around here. We have car seat technicians where families can receive referrals and get car seats if they don't have them available. There may be a fee associated with that. And we also have a new program, Nurturing Pathways, which is a creative dance program, and it uses music and movement to build healthy brains and create body connections, and that is for children that are ages 3 months to 3 years old. There's 3 different types of classes. There are babies classes, waddlers classes, which are children that are kind of pre-walking, and then also toddlers classes, which are children that are actually walking. To 3 years old, and that is a really fun program that we do where parents come and they sing and dance and have just like a dance class with the children, and it is a great opportunity for families. So we really take a kind of a holistic approach to kind of preventing child abuse and neglect. We try to do these programs that promote the families to be successful, and that also the children ultimately to be successful in school. Ultimately, we want to build brighter futures for our children, our families, and just our community as a whole. So I'm going to wrap up a little bit. I know that we're all kind of hungry and it's been kind of a long morning. There are evaluations in your packets. Please make sure that you fill those out so that it can inform our event moving forward. If you have any suggestions or anything like that, we really do want your feedback on that. And I will just say thank you so much for being here. We really do honor everything that all of you do. It really takes a village to raise even just one child, and you guys are really supporting the whole community. So thank you for being here.